But my question now is about the 35 days that it's been now since seniors and kids in our province have been able to access eye care. There are children who are literally now in school having trouble seeing the blackboard. There are seniors who are unable to renew their driver's license, which then, of course, makes them less mobile, less independent, because they can't get their glasses prescription renewed because the service isn't being funded by the government. I spoke to a mom, her name Beverly Murray, last week, whose teenage daughter is literally suffering from eye pain and migraines, and she cannot get her daughter an appointment to have her vision and her eyes looked after by their optometrist. So my question to the Premier is, why is he saying no? Why is he saying no and refusing to get us a fair deal and fund the optometry services that our kids and our seniors so desperately need and deserve?
Deputy Premier and Minister of Health.
Thank you very much, Speaker. And through you, Speaker, I would like to advise the Leader of the Official Opposition that OHIP-funded services continue to be funded by the Province of Ontario. However, the many optometrists in the province, at the urging of the association, have chosen not to provide those services. We're very disappointed with that. We have been engaging in discussions with them, and we're ready to continue those discussions. But the problem is due to the fact that the Ontario Association of Optometrists refuses to go back to the independent mediator and adhere to their conditions in order for the mediation to resume. We are ready, willing, and able to go back to the table to discuss, but this is not something that the OAO is interested in doing, and it's especially concerning that they continue to tell the public that they are waiting for us to return to the mediation table, when in fact that is not the case. We, as the government, are ready to go back and resume those discussions, but the Ontario Association of Optometrists is not.
The supplementary question.
Well, Speaker, I have to say that it's really interesting to see what's happened here in Ontario. First thing that happened was the Liberals delisting eye care services, allowing, of course, seniors and kids, but then seriously underfunding those services for many, many, many years. And now this Premier is making it much, much worse by refusing to come to the table and negotiate a fair deal, and refusing to properly fund eye care. Granted, the Liberals refused to do it for years and years as well, but the problem has become worse under this government, and that is no way, Speaker, to govern. That is no way to govern. This government needs to get serious about cutting a deal that is fair. And my question to the Premier is, why does he continue to say yes to his buddies, to his developer buddies, to the big box stores, but say no when it comes to providing the necessary eye and vision care for our kids and our seniors?
Minister of Health.
Speaker, well, I really appreciate the opportunity to set the members of the opposition to understand what the situation actually is, as well as the members of the public, because the situation is such that the optometrists have refused to come back to mediation. They're choosing to demand an outcome before we even get into negotiations. However, I also appreciate the chance to advise what has actually happened. The government is making a payment of $39 million into the accounts of optometrists who have provided those services, covering an account to cover what's happened in the past, and I totally agree that the optometrists were not treated fairly by the previous government, but we are paying the $39 million, recognizing at the same rate as what physicians would have received from 2011 to when their jail expired to now what physicians would have received. That's how we calculated that $39 million. We've also offered to an immediate OHIP fee increase of 8.48%, retroactive to April 1st, 2021, and to engage in further negotiations with the optometrists about their overhead costs, because we have a responsibility to do that as we attempt to achieve a—
Thank you. And the final supplementary.
The government has a duty and a responsibility to negotiate, not dictate. They haven't figured that out yet, but that's their responsibility. This Premier is easily saying yes to his buddies, but he said no to students, teachers and parents last spring. He said no last summer to long-term care residents and their families who needed the government's help. And now we're seeing it again, as he says no to our kids and our seniors who need to have vision care and deserve to have vision care here in our province. So my question to the Premier is, will he finally say yes, get back to the table and put proper funding in place and commit to negotiating a fair deal so that our kids and our seniors can get what they need in terms of their vision care?
I'll ask the members to take their seats. Minister of Health.
Thank you. Well, the short answer to your question is yes, we are ready, willing and able to go back into mediation, but you can't negotiate when you're the only party at the table. We have said that we are ready to proceed with the optometrists. We're ready to proceed to rectify their very relevant concerns, to deal with the back pay issue, to deal with an increase going forward, to deal with their overhead, and to have an ongoing monthly discussion with them, which is something that is not done with every healthcare group. We want to remedy their complaints. We want to reach a deal with them, but they need to come back to the table. We are ready to go to the table. We have agreed to the mediator's request, but the Ontario Association of Optometrists has not. They're not our conditions. They're the mediator's conditions. We're asking them to please come back to the table so we actually can negotiate. But you can't do that by yourself.
The next question.